I do nursing home litigation at Stark and Stark. We have trial attorneys there that have been doing nursing home litigation for years. And the kind of cases that we see are often those involving the elderly in nursing homes and the care that is rendered by the frontline workers.
Okay.
Some people know them as CNAs, and
Uh,
those are certified nursing assistants
There you
or
go.
certified nursing aides.
Okay.
You also have LPNs, licensed
Practical
nurses,
Right, right.
and some care on occasion delivered by registered nurses.
Okay.
But what we're talking about are the hands-on folks. And what happens in a lot of nursing homes is that oftentimes the errors come about because these workers are under extreme pressure. It's a hard job.
Right.
It's a hard job caring for the elderly, and these nursing homes try to staff as best as they can. Now,
Now, wait, I'm going to cut you off.
thank you.
Because you smiled
Sure.
when you said try to staff as well as they can. I almost sensed that you didn't believe the words you said.
Well, I'm glad you picked up on that, because nursing homes get paid to provide the care. They get reimbursed by the federal government. They tell the federal government what their patient population is and what their needs are, and they get compensated for providing adequate care. The
Okay.
problem is, however, is that they receive that money and they don't provide enough staff in order to deliver the appropriate care. CNAs, for instance, are our frontline workers, and oftentimes you'll have one CNA for 10, 15, 20 elderly persons to provide care.
Okay, so now let's slow down a little bit. So you get one nurse's aide. Let's talk about the example you described. Have you had cases where one aide was required to care for 20 people?
Absolutely.
Okay. So what are some of the things that one aide has to do for every single person on their floor?
The list is amazing. When you figure out what a CNA has to do in order to care for one person, then it becomes an outrageous situation to even contemplate. One of the most laborious things that a nursing aide can do is turn and reposition the patient. Many of our cases at Stark and Stark involve pressure ulcer cases where someone is left in one position and their skin deteriorates, and the next thing you know, they develop a sore.
And is that known as a bed sore also?
That's
Same
also
thing?
known as a bed
Okay.
sore, as most people know them as.
Okay.
But what a CNA has to do, and it is strictly the CNA responsible for it, is turn and reposition the resident every 2 hours.
Right. And you almost said patient. It's the same, right?
It's the same.
But it's their home, which is why you say resident.
Indeed.
Okay.
And the residents are relying on the CNAs to turn and reposition them. The families are relying on them to turn and reposition them. Think about an elderly person that may weigh 100, 200, maybe even 300 pounds.
Right.
And nursing aides have to turn and reposition them every 2 hours, on top of the other activities of daily living is what we call them. And that's just a term that we use to describe getting them out of bed, exercising, stretching them, taking them to a social event, and bathing them, and nursing aides and feeding them. Nursing aides
So
are
you've
responsible
got
for that.
Waking them up, dressing them, showering them, helping them brush their teeth, do their hair, feed them, take them to and from the bathroom if they can, cleaning their adult diapers if they can't, changing catheters, which is more of a nurse job. All of these things. So one aide, 20 people.
That's right.
So now let's bring this into the realm of whistleblower. So have you ever seen cases where a nurse's aide is actually placed under pressure by management or owners to falsify some of the records that they keep?
Well, the pressure comes because the nursing home has a couple of goals. The nursing home has a goal of making as much money as they can and representing to the federal government that they need to be reimbursed for care. And they also have the goal of representing to the federal government and to family members that they are providing adequate care.
Right.
And so we have those two areas which you mentioned at the very beginning. And so the nursing home will pressure the CNA to record activities of daily living that were performed when they weren't actually performed. And how could they be when you have one aide per every 10 patients or one aide per every 20 patients? That is where the pressure to falsify what kind of care was given is placed on the CNA, and the next thing you know, they're falsifying the activities of daily living record. On the flip side of that is the financial consequence of that.
All right.
When you enhance the activities of daily living record, what you're saying to the federal government is that we have performed a service for this patient under Medicare or Medicaid, therefore compensate us. Well, you can see the problem with that if you actually have not done that.
Well, it's really amazing, and you and I have worked on cases where the aides actually chart, they put in the record that they're giving care when the person is dead. We've seen that. We've seen it when the person is down the road in the hospital.
That's right. We've seen it when you have a 92-year-old elderly woman who is suffering from dementia, and you look at the medical record and you see that the nursing home is providing physical therapy services, occupational therapy services, as well as speech therapy, and the woman dies the next day.
Which means that it was never happening.
It was never happening.
So let's talk about it. So now let's put ourselves in the shoes of an aide, because this is never, ever, ever the fault of the aides.
It's never the fault of the aides. Aides are, they receive training in New Jersey. They receive training to become certified nursing aides, and they have an idea of what they're supposed to do to care for a person. And then they get into these nursing homes, and they're asked to do things that they are just not able to do. And that is, go ahead.
I'm sorry, not because of the skill set, but because there aren't enough of them compared to the number of the residents.
And that is important for an aide to keep in mind as they're working.
Right.
Oftentimes when we take on these cases and we start interviewing and talking to some of these aides, they really want to do a good job. They really want to reach out and tell someone. They really want to call some agency or some authority to say, look, this is what's happening in this nursing home. I want to do my job, but I can't.
Okay.
And I want to say today that you should.